Hello, my name is Carolyn Diana, and this is a PowerPoint presentation on problem-based learning. Problem-based learning is a different approach than traditional learning. In traditional learning, an instructor leads a class by presenting information that they need to know in order to solve the problem. In problem-based learning, the instructor transitions roles and becomes more of a facilitator. The instructor establishes objectives and assigns a problem. Usually working in groups, the learner is able to pull from past experiences and previously learned information to then solve the problem. Problem-based learning was originally used to educate medical students, and because of that success, it was used in a variety of settings and on all different educational levels. The success of problem-based learning lies in the communication between the educator and the learner, so it is very important for specific learning outcomes to be established. In problem-based learning, there are some educational tools that are used. The biggest aspect of problem-based learning is the use of collaborative groups. Groups work together to pull from each other to solve a problem. Oftentimes, role-playing can be used in these groups to try to get a different point of view. Another big tool used in problem-based learning is the use of peer review and peer feedback. And also concept mapping can be used to illustrate the ideas from different members of the group. The major points of problem-based learning. This is a very student-centered approach where the instructor is simply guiding the student along in finding their own answers to the problem. Collaborative groups will work together to find the answer. The instructor does not assume a traditional role, instead is more of a facilitator, and should the groups start to get off track, the instructor is still there to keep them on the objective. The problems that are presented for the students are real-world challenges, so they can use their past experiences to try to solve the problem. When students are able to demonstrate their abilities and they are met with success, then they increase the motivation to learn. This approach has proven to create greater retention information and guide students to become self-directed learners. The problem-based learning as related to the domain of learning. In the cognitive domain, students use critical thinking skills from previously learned information to apply to new problem solving. In the affective domain, students pull from prior emotional experiences to apply to new situations and how they would apply that to others. In the psychomotor domain, students gain knowledge through group sharing of skills. The pros and cons to problem-based learning. Problem-based learning can be very beneficial, although it is a lot of preparation for instructors to use. It has been very successful in different settings, although each educator needs to assess when the use is appropriate. The pros to problem-based learning. Problem-based learning promotes teamwork and motivation of learning. It also increases problem-solving and critical thinking skills. It is better for more experienced learners, ones who can pull from prior experience, and it has been proven to increase retention of information. Some cons to problem-based learning can be that students may dislike or be confused about finding information themselves. It may be difficult for new students to try to understand and how to pull from prior experiences that they may not have. It does take extensive planning by the educator and may be difficult due to the lack of resources given to the educator when they were taught. The use of problem-based learning in healthcare education has been very successful. Ungaretti et al. Described the rapid spread of problem-based learning in medical education as testimony to its widely recognized effectiveness in developing better doctors. In a study by Shin and Kim, results revealed increased positive outcomes in nursing education when problem-based learning was utilized over traditional teachings. Because problem-based learning is not just learning facts, Albert Einstein said, "Education is not the learning of facts, but the training of the mind to think." Because problem-based learning is not specific to one area of education, there are many examples for different areas. For example, when using problem-based learning with a peer, Kelsey is a new nurse in the perioperative internship. She has started to rotate through different surgical specialties and works with her peers to guide her through obtaining new skills and information. Kelsey is preparing to complete an exploratory laparotomy when her preceptor asks her to consider what she would do should the case turn into an emergency. Kelsey pulls from what she has learned in the classroom and past cases to consider what she would do. The preceptor evaluates Kelsey's performance by reviewing after each case and making suggestions for the future. In using problem-based learning in a patient example, John was admitted to the hospital after having a diabetic episode. His nurse begins to review his discharge summary with important information about his disease process. She then presents a different scenario that may lead to an admission. She asks him to consider the information and describe for her what John would do. Having experienced an episode causing admission, he was able to reflect and consider what actions to take for different scenarios. A student teaching example would be that Callan is enrolled in a college that utilizes a problem-based curriculum. In her nursing class, students are placed into groups, with each group presented with a different case study of a mystery diagnosis. The groups are to work together to discuss and solve the diagnosis. Through previously learned information, past experiences, and unique points of view, the group is able to work together to complete the assignment.